Now let's talk about infertility. What is infertility and what are some different causes of infertility? So when you think about infertility, what was the first thing that pops up in your head? The ability of not being able to produce offspring, all right? So no babies. So someone that is infertile, they can't make babies. And so there are hundreds and hundreds of reasons of why people become infertile, but because of the sake of this lecture, and I'm trying to keep it within 5 minutes, I'm gonna focus it based solely on just a couple of mechanisms of why it happens. And we're gonna separate it based off of gender. So women and men. So let's start off with women. So what are some ways that these women can become infertile? So let's go back to the beginning. What gives them their fertility? Well, their ability to ovulate and produce eggs. So if they can produce eggs, they usually are considered fertile individuals. Now, when we look at women in terms of fertility, what can go wrong that would make the women infertile? Well, we can look at where the egg first begins. So congenital defects, so let's look at congenital defects. For example, let's see, polycystic ovarian disease. So this is an example of a congenital defect where the body begins to create these cyst-like, in the female, cyst-like structures that makes the ovaries non-functional, right? It basically looks like these little grapes, these little cysts that actually form in the ovaries, which blocks the follicle from forming in order to eject the egg. Other problems with just ovulation. So abnormality with any kind of ovulation disorders. So for example, there could be some kind of hormonal imbalances. There could be a problem with the ovaries actually ejecting the egg from the follicle. This is an example of any kind of ovulation disorders. Now this is all specifically the ovaries. Now let's go to the next structure. What's the next structure? Fallopian tube. So we can look at some kind of fallopian disorders. So what can cause these fallopian disorders? Well, if we look at the fallopian disorders, we usually think about some kind of blockage, right? So after ovulation that takes place, the egg is transmitted into the fallopian tube, ready for fertilization. But just because the egg is sent to that location doesn't necessarily identify the woman as being fertile. It needs to have a proper passageway for the sperm to enter and fertilize the egg. So fallopian disorders, like a lot of blockages, can arise. Perfect example. Let's see, let me grab my green. Endometriosis. What is endometriosis? So this is involving the endometrium. So endometrium is the innermost layer of the uterus. And in certain kinds of environmental congenital abnormalities, a piece of the endometrium migrates into the fallopian tubes. When this migrates in the fallopian tubes, this blocked tissue can actually inhibit the passageway of sperm entering the fallopian tube for proper fertilization. What are some other examples of this condition? Pelvic inflammatory disease. So whenever the pelvic region in the female becomes hyperinflamed, which can cause certain blockages of the female reproductive system, and also certain diseases like UTIs and STDs. So urinary tract infections, some kind of pathogen that comes in from after urinating, and or we could talk about any kind of STI, so sexually transmitted infections that are created. And these pathogens, the reason why they're dangerous in terms of inhibiting fertility or making the patient infertile is because when the bacteria comes to that location when it's not treated with the antibiotics, that inflammation and that war, quote unquote, that's being taking place with the immune system can lead to a lot of scar tissue building up around the fallopian tube, causing another form of blockage. All right, so now we talked about the women. Now let's talk about the men. So what is the difference? So when we talk about the men, I only want to focus on really 3 parameters that actually causes this male infertility. So it's not selective with only women. Men also are a very big cause, okay? So first condition, azoospermia. So azoospermia is basically another way of saying low sperm count, right? So when we talk about a man that's fertile, how many sperm numbers are they supposed to have? About 100 to 200 million sperm. Anything below that, around maybe like 50 million to 20 million, 20 to 50 million, that's considered azoospermia. So either very low or no sperm count with the men, all right? This is an example of low sperm count, and this can lead to infertility. So the woman can have everything normal, right? Perfect egg, perfect fallopian tube structure, everything looks great, but the man has not able to deliver the actual package that's supposed to be entering there, right? So this is this. Another example is varicocele. Varicocele, we talked about it before. So varicocele is an abnormal hyperdilation of the blood vessels in your scrotum, right? So high blood vessels, high blood flow. What happens to the temperature of the testes? It increases. What happens to the sperm population? It dies. If you remember before, the reason why men have a scrotum is to hold the testes outside the body, because the sperm needs a semi-cooler temperature in order to produce normal sperm. Varicocele prevents this because you have this hyperdilated blood vessel that increases blood flow into the scrotum and surrounds the testes, which causes sperm to begin to die. All right, and the final condition is teratospermia. So teratospermia is usually due to some kind of abnormal mutation. Either it can be congenital or it can be environmental, where the sperm has a improper shape. So you can see like a sperm with two heads, or a sperm that's lacking an acrosome, or the tail is missing for this sperm. And so this is due to certain kind of either congenital or certain kinds of toxins that causes these different kinds of mutations. So any kind of radiation that can cause these kind of problems as well. So that's why they always say, be careful whenever you get x-rays, whenever you go to the doctor, make sure they're covering all of your glands, specifically, your testes, so you don't have this instance of mutations that are being generated, making the man infertile.